through the system.
So people who are listening, those people who think that this move towards simplification and actually makes privatisation of the health service more likely as opposed to less likely. So in response to your questions to Paul, you've both been dancing around this, so I thought I'd just ask the question that most of the public will be sitting there. Hang on, let me ask the question that most of the public will be thinking. People will say that it makes it more likely it'll be bits will be privatised. Others will say not. So I'm going to ask you the reverse of that question, which is, how can you assure them that what work have you done that will ensure that that work is continued to really be done by the NHS? Or is NHS just going to become a badge?
No. And the answer to the question is, you as a committee looked at this question very carefully last summer, and you made some recommendations as to how we could ensure that there was appropriate public provision and accountability. And in the light of that, we have gone away and kicked the tires and have come back and said, we agree, here's the proposal. So we are suggesting that the integrated care should be public providers. And I mean, frankly, it would be a strange situation if, having been accused of one thing, then when we come forward and respond very concretely with those concerns, people then do a 180 degree and say, oh, well, that's exactly what we were worried about in the first place, when it's the precise opposite of what they were previously critical of.
Simon, I absolutely appreciate that. What I'm really saying to you is, having done that, just express or enable people to understand that you have put in place something, whatever it is, that would assure them that this is not likely to happen. I'm really just giving you the floor to actually say that this is so much more not likely to happen. And instead of just giving blanket reassurances, which, depending on your original belief, you either believe or you don't believe.
Well, I think that's the key to it. There are some beliefs that are not shakeable by any empirical evidence. But, I mean, we have actually put this on the table in black and white in Chapter 7 of the long-term plan, and, frankly, the reporting of it has confirmed that what you say is what we're proposing.
I'm just going to be much more concrete, right? There's no privatisation of the NHS on my watch, and the integrated care contracts will go to public sector bodies to deliver the NHS in public hands.
Voila!
And
that's what Simon was saying.
Wonderful. And of course it was a recommendation. It's what we recommend.